I am Santisha Walker, your nurse advocate. I'm a healthcare professional serving as a registered nurse and a certified wellness coach. Today, I would like to discuss medical gaslighting. Now, previously, I focused on your attitude towards your healthcare providers. Now, I would like to focus on what you need to do if your healthcare providers or professionals are dismissive towards you. Now, as a reminder, this channel is not to discredit healthcare professionals. It's used to bring light to real life situations and how to navigate through those situations. Now, I'm sad to say that medical gaslighting happens quite often, believe it or not. Anyone can experience medical gaslighting. However, women, people of color, minorities, and marginalized groups commonly experience gaslighting the most. And typically it's due to a subconscious bias. Now, let's talk about what medical gaslighting is. It is basically when a healthcare professional ignores your symptoms, okay? Your concerns are dismissed, they're trivialized, they're downplayed, right? Causing you to think that what you're actually experiencing is not real. It causes you to question your own sanity. So some examples and signs of medical gaslighting would be, your request for treatment or testing is continually ignored. You're discouraged to seek a second opinion or to even do your own research. Your concerns, again, are chopped up to just your imagination. You're not provided medical records upon request. Your healthcare provider is not actively listening to you and not asking follow-up questions. You may feel as if you're talked down to, and you're told, oh, you're too young to be having those symptoms or to experience this, or you're just stressed, or, oh, it's all in your head, or, your pain is manageable, even though you know yourself that you've been trying to manage your pain. After a doctor's visit, you may even question the severity of what you're experiencing. Medical gaslighting, when this occurs, it actually can take a very long time, even years, for you to get the correct diagnosis, which in turn delays your treatment, for your condition. And so it can actually lead to misdiagnosis, mistreatment, and medical trauma. So when gaslighting is happening, it can cause you to go from medication to medication or procedure to procedure. It's just a prolonged process. So you begin to then question the healthcare system. You lose your trust in it, right? It is very heavy on your heart, on your mind, on you physically, right? It wears you down, and it can just make you feel alone in your situation. And you could be made to feel as if, oh, well, I'm just meant to live with what it is I'm living with, when that necessarily might not be the case. So if you are experiencing medical gaslighting, here's what you need to do. Number one, have a friend or family member with you at all times. This could be FaceTime or speakerphone, but I prefer in person. The support person is going to be there to be able to really observe the dynamics between you and your healthcare team. Number two, voice your concerns. Use assertive language when it's time for you to communicate how you're feeling about your medical team, disregarding you or dismissing your concerns. Number three, collect evidence. Literally take detailed notes. Use date and time stamps. Create a paper trail and literally send an email recapping what it is that you spoke about. Now, if you do decide to record anything, make sure you are getting a consent from all parties involved. Number four, inform those who are in power, right? You have the right to go to any department for patient advocacy, for the healthcare facility, for the doctor's office, for that hospital, so that they can know what's going on. You also have the right to go to the state medical board or the state nursing board for that healthcare professional. Number five, seek support. And when I say support, I mean professional support. A therapist can actually help you work through what it is that you're experiencing. They can help you with role playing. They can empower you to actually ask questions and how to deter or how to get over the hump if your provider is deterring you from getting your questions answered. If for some reason you've gone through these steps and you're still experiencing medical gaslighting, change your doctor, okay? It is not your responsibility to care about how your doctor is going to feel if you were to switch doctors, all right? It's always good to get a fresh set of eyes on what's going on with you, okay? So don't be afraid to change your doctor, change your primary care provider, ask for a referral, do what you need to do. Remember, knowing how to advocate for yourself is going to lead to better health outcomes and a higher quality of life because you're able to make well-informed decisions. to prepare you to continue to advocate for yourself and to gain confidence as you communicate with your doctors and your care team. There is a resource that is available to you on demand. You can access it at any time. On this channel's homepage, in the banner, there's a link entitled Advocacy Ebook and Guide. You can download it there, or you can go to santishawalker.com/books to access that health advocacy ebook and guide. Now, I want you to take responsibility and I want you to affirm, I am preventing and properly responding to medical gaslighting. Then prepare, make a plan, and execute. Stay tuned and be sure to subscribe to this channel. There's more information coming about health advocacy. Let's continue, guys, to gain clarity on how to confidently advocate for our health and wellness. I believe you can do it. I got you covered. Until next time, bye-bye.